Now, without delay, we will give each presenter the opportunity to speak for 10 minutes on the impact of COVID-19 in their regions. What were they experiencing when COVID-19 started, and what is happening now? How the needs in their communities have changed, and a testimonial or a story of a client. Again, we'll put forward your questions to our speakers. Please submit them in the chat box below to Roberta Pronto. If we do not get to your questions today, we will follow up with you and provide you with an answer after the call. So without further ado, I'd like to start off with Executive Director Major Gordon Taylor and Addictions Counselor Anna Oppa from the Winnipeg Center of Hope.
Well, good morning. It's great to be with you today to have this opportunity to share a bit of our story. The Center of Hope is a large place. I'm in my office here right now, but this doesn't really show you what happens in the building. It's 2 buildings and 5 different programs and a variety of things going on, including shelter for adults and for families and other programs. Anna's going to talk a little bit more specifically about one of our programs. When COVID hit, when it arrived in Manitoba in March, we were up to that point kind of business as usual, but immediately had to adjust some things. One of the big physical changes in the building was the distancing of our beds in order to allow people that space between themselves for sleeping, which of course meant less beds, reduced capacity. The other immediate challenge was that it was still winter in Winnipeg when this pandemic hit. And with reduced beds, not only for ourselves, but all of the shelters in town, it meant an immediate challenge. Where can people go to get in out of the cold? We did have some empty space in one of our buildings, the smaller of our 2 buildings here on Martha Street, and we were able to, in conjunction with another agency, open a temporary winter shelter to help fill some of those needs for a few weeks. And also in conjunction with other departments in the Salvation Army, you'll hear more about it later, we opened our Wiedema Center over on Logan, a few blocks from here, as an overnight warming center. Reduced capacity, although also had a very negative impact on the overall operation in that most of our income is on a per diem, per use for the beds that we have, and so less beds meant less income from our government contracts. So that was a challenge we've been facing all along. Some of the changes we made within the building to address the needs presented by a pandemic were extra sanitization, less turnover in clientele. We tried to encourage people to just stay, kind of weather the storm with us. We suspended all of our group activities and programs. We put an overnight curfew on the building. On the positive side, we saw this incredible spirit of cooperation amongst the agencies dealing with challenges in looking after the homeless during this time. A great sense of cooperation that is continuing through, and I think will be an asset going forward. This was all back in March. In April, we quickly had run into the problem that if someone did go for testing for COVID and were told to self-isolate, that's a difficult thing to do if you're staying in a shelter or any group accommodation type setting. In conjunction with some other agencies, we're able to propose a solution, and a center was open, run by Main Street Project, to help people isolate from the homeless community if they went for testing. Our contribution for that was to provide the transportation. We have a vehicle that was given to us earlier this year by the province, a retired ambulance. We put that on the road, and 7 days a week from April through the end of June, we provided all of the transportation for people from this community going for testing, isolation, back to shelter. And that was a great opportunity to be able to serve in that way. We also implemented some other measures within the building, interview screens for speaking with our clientele, the use of PPEs for our staff, although there were a lot of supply issues early on for that, but we've got to a better spot now. We did actually close our cafeteria, but we still fed the people living here. We just did it as takeout meals that they would eat back at their rooms. We held regular update meetings with our management team on a daily basis at first, following them up with a memo to all of our staff, keep them in the loop on what was going on as things were changing every day. And I think that was a real comfort level thing for the staff, just to be updated and know what's happening. And we've continued to do that. The Free Press and the Sun provided free newspapers for our clientele, just to give them something to do during the day, and that was much appreciated. Into May and June, we ran into some new measures. Winter was over, but now we were running into hot weather problems. With the distancing in our building, we had lost our, what we call our day room, our space for people to drop in during the day. So again, that need was filled by our Wiedema location around the corner, and they continue to operate a day shelter up to this point. We're also impacted very greatly by more lost income when the SERB funding came out. A lot of our clientele applied for it and moved out of our building into hotels. Of course, being paid on a per diem basis, we lost income there. But the province did step in with some emergency assistance for us towards the end of June that has helped make up for some of the lost income, although we're still in that situation today with less income than normal. Throughout the summer months, July and August, we've started reopening some of our group programs, our chapel services, group activities for those in our addictions treatment program. Anna's going to talk more about that in just a moment. The other thing we've seen that's a big challenge and a big concern is the escalating violence in the neighborhood. A lot of that caused by the border closures and people experimenting with different drugs than they normally would use and not knowing how that will affect the behavior. And we've seen a lot worse results because of that over this summer compared to previous summers. So there's lots of ongoing challenges, but we continue to move forward, and with God's help and your help, we'll continue to do that and meet those challenges as they come. Anna's going to tell you a little bit more now about our Anchorage Addictions Treatment Program and kind of some experiences there during this time. Go ahead, Anna.
Hi, I'm Anna. I am an addictions counselor at the Anchorage Addictions and Rehabilitation Program. So the Anchorage program is a 30 or a 90-day program where participants are provided with one-on-one counseling, as well as addiction classes, group sessions. During the peak of the COVID-19 pandemic, which is currently still ongoing, our program was temporarily closed for a duration of time. And during this time, we weren't able to operate as usual. So we weren't able to facilitate our groups as well as one-on-one counseling sessions and the addiction classes. So we're able to provide our participants with certain workbooks regarding addictions that they were able to work on and kind of hand back to us or call us whenever they had any questions. Since we were not able to have the one-on-one counseling sessions, our clients have always had a free phone on the floor. So they were given the options to call their counselors whenever they felt the need to talk, or just talk about whenever they were in crisis, or just have a session. One thing that stood out for us, or a participant who stood out for us during the peak of when the program was currently closed, was an individual who had just enrolled in the program, and he came to us from the justice system. Now, this individual had no funding, had no place to go, nor a family in Winnipeg. He's an immigrant from the Philippines, and he had just lost all of his landing papers as a result of his previous drug use before his involvement with the justice system. Although the program was closed, we were still able to work with this individual in terms of helping him deal with his addictions, working with him through his issues with the justice system, and still accommodating in the program while we're still battling with the closure from the COVID-19 pandemic. Just recently, on Monday actually, this individual or this participant completed the 90-day program at the Anchorage Addictions Program. And it was such a joy for all of us as staff members. And he was even much grateful because he came to this country 6 years ago and got involved with, of course, bad people dealing with homelessness for a long period of time. And being able to be so welcomed into a program that's helped him deal with his addictions. And we are still continuously working with him in order to figure out how to get his landing papers back and just navigate through the system. For him, he stated that being in Anchorage was kind of creating the hope, and just like we are called the center of hope, and it was such a joy to all of us again, and for him as an individual. One of the things that we did or we implemented that really stood out for me at least, and even staff members and our participants during the peak of the COVID-19 pandemic, was the fact that we're able to provide our participants with the option of residing in the program, or if they had a safe place to go, they were given the options to leave and come back when the program had restarted. So that was really good because some individuals had safe places to go, and due to some concerns they had, they were able to leave and come back when the program is started. But individuals who had no place to go were actually able to stay, still able to be provided with services. I mean, we weren't able to run as usual, but we were able to still cater for our clients, and that was really important during the time of the closure. Thank you.
Thank you, Anna. I do have a question for you that I have here is, what was the interaction like while participants were waiting for the program to restart?
Individuals who were in jail or involved with the justice system, they had to go through a series of I guess they had to get tested for COVID, and they were still able to come into the program as long as we had no concerns of possible exposure. They were also advised that the program wasn't running as usual. We were running as a sober living facility, so they were still expected to maintain sobriety and follow the rules, but again, we couldn't have the classes. So they were advised of that, and they were given the option to come as long as we had no concerns of exposure.
Thank you very much. Doing great work there. Gord, I have a question here for you as well, and that is, what has the worry been like of the staff and clientele of the shelter about getting sick?
Well, at the beginning of the pandemic, when there was a lot of unknown factors and a lot of different information coming through media and social media, there was a lot of worry, especially among our housekeeping staff. But early on, I was able to get the right contacts at public health, people I could ask questions of and get answers right away. And we were able to set our staff members' concerns at ease quite early on by showing that we were doing the right things and clearing up some misunderstandings about how the disease might be spread. With the clientele, it's been a mixed bag. First, some weren't even aware there was a pandemic going on. But over time, the people who've been staying with us the longest have settled into, I think, a comfortable routine. They're following the protocols, the distancing in the dining room, which is now reopened, the distancing in our programs and our interviews, the interview screens, used to seeing people wearing masks. I think the people who've been here a while have settled into a routine, and then that helps any new people who move into the building get settled in quickly as well.
Thank you both for all the work you do at the shelter to support the vulnerable in downtown Winnipeg.